Mental health of children and teens is a growing concern, especially in the LGBTQ community. Transgender and non-binary kids have especially high rates of anxiety, depression, and suicide. Two experts discuss why and what to do about it, and one mid-state native shares her story. Here's Sonica Bargo.
Growing up in central Pennsylvania as a very closeted youth was difficult.
Not just difficult. For many, when growing up non-binary in Lancaster was complicated.
I grew up Asian, so there's already a cultural component there. I grew up in the Catholic Church, so there's another religious layer.
And scary.
My whole life has just been dictated by fear. The fear of being myself, the fear of being a sinner.
Wynn is open about her identity now, but as a child, her mental health suffered, and it affects her today.
I live with some pretty severe suicidal ideation. I was hospitalized a couple of times.
She's not alone. According to the Trevor Project, an LGBTQ suicide prevention organization, half of transgender and non-binary young people seriously considered attempting suicide in the last year. Nearly 1 in 5 attempted it.
This first and foremost really should be seen as a public health crisis.
Dr. Kristen Ekstrand is the medical director for LGBTQ health quality at UPMC.
You really don't see rates like this in other groups.
She says kids are reporting more harassment. A Trevor Project survey found over 60% of trans and non-binary youth say they felt discriminated against because of their gender identity. Nearly a third say they've been threatened or harmed.
When that conflict is occurring both at the family level, at the friend level, at the social level, it is very hard for kids to get a break. There's really no safe space for kids where they can sort of say, I can be myself.
All of those kind of add up as stressors and traumas that kind of weigh on mental health.
Cassie Ellison, a therapist at the Lancaster LGBTQ+ Coalition, says with her patients,
I always encourage looking for both the positive and the negatives.
She wants them to find hope.
The main factor that people see that leads to suicidality is a lack of hope.
Other factors do play a role. Supports at home and at school.
The number one thing is having parents who support you.
But as the transgender community has become a political flashpoint, finding that hope is easier said than done.
The hardest part for me, I think even today, is trying to find hope when you feel like the world is against you.
But it is possible.
I find a lot of hope and strength in my community.
Wynn says little things get her through.
When I go to the store and I make eye contact with somebody else who's also trans, and we just have this moment of knowing, that gives me a lot of hope.
And that can make all the difference.
I don't care how little it seems. I don't care how stupid it seems. Any reason to keep going is worth it because you're worth it.
Sonica Bargo, ABC 27 News.